Hey, what's up, everybody? Cameron Hemphill here, your host for Medical Millionaire. Hey, first off, guys, thank you so much for taking the time to tune to the podcast. Our goal is to give incredible value and insight for practice owners. So, if you're thinking about getting into the med spa space or you are looking to take your aesthetics practice to the next level, all of these episodes that we create, they're 100% designed for you and to help you take your practice to the next level. So guys, today I have a extraordinary guest on. She's out of Newport Beach. She has an absolute incredible business. It's the Beauty Boost Med Spa. Anisa Madower. We've known each other for a long time. We've got to hang out a few times at conferences. And this woman, she's a powerhouse, guys. She was the youngest ever recorded to achieve her DNP, which is amazing. Anisa, thank you so much for coming to the show.
Thank you so much, Cameron. I am so pumped to do this with you because my dream was always to be a guest on a podcast, and you literally made my dreams come true. So thanks for having me.
Is
Can't
this
wait.
your first one?
Yeah,
Oh my God.
right?
I love it. I love it. Well, it took so much time to coordinate. I think we tried to make this happen for like the last 2 months.
I know. I know. I have like a strong belief that I have to take an international trip every 3 to 6 months. So sorry, Croatia got in the way, but it's that business owner break where you just need to detach for a minute.
Yeah, that makes a lot of sense. I agree. I think like sometimes we can get caught up in this entrepreneurial world where we just have to go, 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 go. And if we don't take the time to just reset, recalibrate, then really like burnout's real, right?
Yeah.
Like
Mhm.
you're a practice owner and entrepreneur, trying to run a practice successfully is very challenging. And so you have to have that time off in order to continue to accelerate.
Absolutely. And you know what I feel every time I come back from these trips, whether it's a weekend, a week, or 2 weeks, is I feel inspired. It's just kind of coming out of that. I call it a creativity cramp where I feel like I'm so into like this marketing and trying to find out like how we can really combine our aesthetic procedures where it's super attractive to patients because for at the end of the day, Botox and fillers can be a little bit mundane and that's what my practice was built on. That I get into this cramp and that when I detach from it and I just remove myself from my surroundings, I just get inspired. And I find that a lot on the flight there, flight back, when I'm just really taking that time to not be on my phone. It's these ideas come flowing. So I think it's necessary.
It's funny you say that. That definitely happens to me as well. And also, when I talk to other practice owners and entrepreneurs, I see a similar pattern,
Right.
right? It's like, hey, take the time to unplug. And what's interesting is then I think our brain has the capacity to explore areas of opportunity that we couldn't see happen because, like, we're just in the business all day and trying to either like solve problems, put out fires, like get the checklist done, right? So that's huge.
Yeah, definitely.
So tell the audience you have an incredible background, and I want the audience to get to know more about you. What got you into the aesthetic space? I know you have a very strong clinical background, but can you walk us through that journey up until the point where you're like, you know what, I'm going to become a practice owner, and how that shift took place?
Yeah, definitely. So when I was an undergrad, aesthetics wasn't very big at the time. I started undergrad in 2008, and it seemed like people were doing Botox, kind of flirting with filler, but it wasn't a thing. So I really didn't know about it. I just knew that in undergrad I loved makeup and I my passion was really to do makeup and be a Mac makeup artist. Like that was my aspiration in life. And my dad being from India and education being such a priority in our culture, he said, you can't go to beauty school just yet. You have to get your bachelor's. That was like the minimum requirement. So at the time, I'm like, okay, how can I combine beauty with something that I do like, which is science? And I realized I'm like, oh my gosh, there is something called cosmetic dermatology. That's what aesthetics was back then. So I decided that I would do an internship with a cosmetic dermatologist in San Juan Capistrano, California, Dr. Jeffrey Klein. He pioneered tumescent liposuction, which is really cool because you do lipo under just, lidocaine that you don't need to be put under. So I'm like, wow, he really is in the forefront of cosmetics that can be done in the clinic. But the reality was that he never wanted me by him because I was just like an intern. He always put me with his nurse practitioner. And I'm like, gosh, I don't want to be with a nurse. What does a nurse know? Just kind of that mentality that a doctor is always superior, right?
Right.
But I was really happy to see that every time I shadowed this nurse practitioner, she did everything the doctor did. She diagnosed, she prescribed, she treated medical derm, she did aesthetics, right? Or the cosmetic derm, which is Botox and filler. And she was so beautiful and patients preferred her. She just had that connection. She was everything that I wanted to be. So that's when I'm like, you know what? I have to become a nurse practitioner and practice this side of medicine. This is so cool and fun. So I went on to, at UCI, I was one of their first graduates from their program, the nursing school. And I just had that idea the whole time in mind that I wanted to become a nurse practitioner. So I went straight from high school to undergrad to my doctorate because it's a BSN to DNP at USD and is an accelerated program. So that's why I was the youngest to graduate in 2015 because I just went straight through from high school. And my first job out of grad school was becoming a aesthetic, nurse practitioner in the medical spa space. But just a little background, the whole time I was in grad school, I was an ICU nurse. So while doing night shift full time, oh my gosh, these are the days. UCSD, it was the cardiovascular center, and then Sharps doing the medical ICU. And then at some point, UCI, I was doing a little bit of travel. It just, I think that critical care background made me appreciate aesthetics so much, right? Because you're in the hospital on your feet for 12, 13 hours. You're dealing with really, really sick patients that no matter how hard you put your whole heart and energy and love into these patients, at the end of the day, whether they survive, right, the doctors will get the praise, or whether they don't survive, then the nurses take the heat. It's just, and then you feel that grieving, right? So you just don't feel that you're really winning with your patients. And I wanted more. I wanted something that was transformative that I can participate in and that you can physically appreciate. So that's why I loved makeup, because you can have that transformation. And that's why I love aesthetics, is you can also have that transformation, but you're not in this weird in between in the hospital. So when I went into Medspa, did aesthetics, loved it. My heart was beating. I loved it. But the only thing I felt that was lacking when I did aesthetics in 2015 was that there wasn't a profound education, right? Like there was no track. And I understand that still can be a challenge today, which I'm really praying and hoping that it will change. I wanted to go back to what grounded me, and that was education, right? And get my doctorate just for fun. I could have stopped at my master's. I could have stopped at my bachelor's like my father wanted, but I went all the way through. So that's when I went back to a more teaching setting, right? An academic setting of UCI plastic surgery. I was one of their first, nurse practitioners in the plastic surgery department. I got to go in the OR. I got to assist plastic surgeons doing facelifts, where I really understood facial anatomy really well. I got to, do post-ops with them for plastic surgery cases. And then I got to see, more of that medical side of like reconstruction. But I still felt that my care was so limited in the OR setting and in the clinic setting that I was just this almost like assistant or high-end medical assistant in a way, that I wanted, again, to go back to autonomy. So I went back to the Medspa settings, and then I just realized, you know what, I really want to do something different, right? And I really want to just enhance people's beauty, just give them like a little boost, not just really shove like a whole syringe of filler if they don't need it, or do X amount of units because the practice said to push these units. I just wanted a little boost to enhance people's beauty. And that's where I came up with the name Beauty Boost Med Spa. And I decided to brand my entire business around this idea that you just need a little boost to enhance your beauty, not augment it. So that's why every procedure you're going to see at Beauty Boost is lip boost, and we go to correction. If you need half a syringe, that's what you'll get. If you need a full, if you need 1.5, if you need something more than just the 1 ml syringe, we will do it. We'll price it per areas, which is why I really, really love our business model. So it's really cool to see it. We're 6 years in, and we are in Newport Beach. It can be very challenging, right? Because there's, I want to say last time I checked, 25 med spas in my zip code alone. So there's one on every corner. So you really have to think outside the box of making yourself different. That's why we're all pink at Beauty Boost. That's why we are, we really go hard on marketing, so people know we even exist in this random building, right? So it's very, very important that your marketing is important and on point.
Yeah, one of the things you've done an incredible job of is your brand.
Thank you.
right? Is you've built a wonderful brand. You know who your demographic is. You know who your audience is. You know who you are, and like everything coming up into even how you what you called the name Beauty Boost, right? Comes from. I mean, that's probably deep inside your core, and
Right.
that's something that who gets the benefit is your patient, right? Which is really cool. So I don't know if that was intentional or not, but the fact that everybody's pink and you know your demographic, you know your brand, and you have worked on that brand for 6 years, guys, that's exactly what you have to do in order to create that separation,
Right.
right? Because in Newport Beach, there's options. It's an affluent area. We were just talking offline about how it's a bubble. It's not getting hammered by maybe some other markets that are having some economy challenges,
Hmm.
right? But there's options, and so you have to take the time, guys, to know like who you are, who your demographic is, and then tailor your marketing efforts to that. And
Right.
that's something that you have done an incredible job of. And I've been taking the time over the past couple of hours. Obviously, we've worked together for a long time, but just going through your websites, going through your social media, like outside of Instagram, what you've done on TikTok, what you're doing on YouTube, you have a Patreon page, like it's very impressive and everything. You guys, I would assume you have very strategic marketing plans and agenda based on the content you put out. Can you talk a little bit about that?
Yes, it wasn't always like that. So I knew in order to be found, like I said earlier, on anywhere was to promote myself on a social media platform because my building was so random at the time and it was so old and that I would never expect someone to just walk by, go into my building, walk upstairs, find my little suite, and then it'd be like, wow, you guys exist. Let me get treatments from you. So I know I needed to be really strong on social media. So when I first started, I actually rented out one little room out of a shared suite. It was like I want to say there was like an IVF doctor that was sharing the other room. There was a esthetician in the other room, and then an IV infusion nurse in the last room. So there's four of us,
Mhm.
and I wore all hats. I'd walk in and I'd sit at the front desk. I'd check my patients in, go to the back, put on my white coat, okay, treat the patient, come out, take off my white coat, check out the patient, and then right there and then I would post a before and after. So I was my own front desk. I didn't have a medical assistant. I was my own social media manager. And then my husband eventually became my front desk. And then that's how I kind of grew. And I always say I grew by accident because I never thought it would become what it is today, which we're in a 3,300 square foot office with, I think, six, I always forget because there's so many rooms, but six exam rooms. And I have three other injectors that I work alongside. And it's so cool to see my business evolve based on the principle of just marketing.
Yeah.
And I just started with Instagram and I would just post once a day. I'll do stories here and there. And then I hired a full time social media manager who entered in, I think, year 3, and they were doing it full time. So they were doing all my Instagram, and then it was translating over to Facebook. And then we found out about TikTok 3 years ago.
Yeah.
And we're like, and when everyone was like, no, these 13-year-olds dancing, like, that's so stupid. This
Yeah.
platform's gonna, die out. And everyone thought it was so silly. We saw it as such an opportunity. We're like, nope, we're tapping into that. So we were one of the first in aesthetics to kind of really be, very heavy on
Right.
TikTok. YouTube is something that I always like watched makeup YouTubers do their makeup, and I was fascinated by it. So I thought it'd be really cool to be someone in the aesthetic space, really going on YouTube and sharing like what's in my exam room, like they do with like what's in my makeup room, right? Or
Yeah.
how can you become an aesthetic nurse? I talk about my journey because it's hard.
Yeah.
Nobody knows where to start. And I think as a byproduct, people said that I'm very inspiring because I'm so relatable. So I think what it comes down to, the magic of marketing is just behave like your audience, right? Just show that you're normal. You want the same things they do. What is the best that you would do for your face? Treat them like almost like a sister. And I have a big sister, and I talk to her all the time, like, oh my gosh, you have to try this lip liner, or oh my gosh, you have to try, you know, microneedling combined with some other topical I just tried. And when you talk to them more from a friend or a family standpoint, that trust is there, and it will carry on throughout all of your marketing platforms.
Well said. It's so true because I think sometimes people they have a hard time making that like translation in order to showing social, which creates a connection.
Right.
right? And so I bet when people come in and see you, like new patients that maybe have never seen you, they start following you first, right? They're going to check out your work. They're going to look at your reputation. They're going to look at your site. And then it's almost like immediately creates a connection
Right.
before they physically see you,
Right.
right?
And I have girls that come in and they're nervous. They're like, "Oh my gosh, I feel like I know you." And this is great. Like as if I'm this mini celebrity to them. And it's so fun to see that because that connection is already made. And you don't really have to try as hard during your consults because they've seen your work. They've
Yep.
seen who you are. They see your morals or values of you keeping up with your education. They already know all this. So
Yeah.
they don't need to, you don't need to, you know, try so hard to overwin
Yeah.
their
And it's
approval.
like marketing is interesting. It's like, look, it's definitely a way to get new patients for sure, but it's also a way to just like to your point, to just make that consultation process super effective.
Right.
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 I bet, like, most patients that come to see you for the first time, the amount of, let's just call it diligence, due diligence, if you will, like the amount of review they've done to say, hey, is like she right for me? They have looked at a lot of content.
Totally.
And,
Mm-hmm.
and so they've almost qualified themselves by you putting out the free content out there,
Right.
which is
Right.
really cool. Yeah. I
Right.
love that.
I think especially when you add value, right, to something that they didn't know, or it just makes sense to them, they immediately are like, "Oh, she's someone that really knows her stuff because she taught me in a way where I understand it, and now I want to go to her to further learn about what I want to, enhance."
Yeah.
So,
Yeah, I like that. And you know what? You made a point earlier about, you wore every hat and you were in a, smaller office and you never thought it would get to this point. It's a journey, you know?
yes, right,
And I mean, like, I think that there's people that want to get into the medical aesthetics arena, or maybe that they've been in and they haven't really quite got to where they want to go. And they have the tendency, and I see it all the time, so I want to bring it up, but the tendency to maybe go pull up your social media and say, "Oh my gosh, like I want to be there," and they think that they can maybe get there overnight,
right.
right? You've been working on this for 6 years.
Oh my gosh, yes. I was so weird in the beginning on camera. I cannot tell you. I would say things that were not even like true or real. It's just almost like improv. You're like, whoa, whoa, beep, 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 just like you want to be entertaining and you say
Right.
anything that comes to mind. It's like word vomit or it was awkward. It's definitely a skill. Just like aesthetics, you will refine if you're consistent with it, right? And I was practicing this every day, whether I was doing videos on the fly in between patients, or I was doing stories of follow me around, or I was doing lives. Like it's weird on lives because it's just when you're quiet, people don't want to interact or they leave and you want to keep that engagement going. So
Right. Right.
it's a skill that I think anyone can truly do. You just have to do it. And you have to get over like, oh, what if people, what will they think about me? Get over it.
Get over it.
We all
Yeah.
do.
Well, they just scroll to the next video, right? Like it's just like
Yeah.
that. Yeah. I mean, I think we get caught up in our mind of like what others think when really, like, if you can table that and
Right.
just not even care,
Right.
right? Then that true, even more authenticity comes out, right?
Right.
Yeah.
Absolutely. Absolutely. And at least you're doing it is what, the takeaway is. A lot of people are too shy to do it and they never do it. And they always wonder what if, right?
Mhm.
But at least if you're doing it, you're already ahead of the game. And so little people feel that confidence right now to talk about it. But even if you know just a little bit about aesthetics, talk about it. We're all on this learning journey path together where it might, introduce someone that is so new to whatever you're providing to be on that learning journey with you. And then your
Yeah.
patients grow up with you, right?
Yep.
And they will follow you as they age because they see that you're learning and progressing, that they'll continue to go to you because they want to grow up with your level of knowledge as well.
Yeah, it's not like they just come in once and then they know everything. Like this is a evolving, industry. This is a specialty that actually, I don't know if I've seen a specialty in an industry move as fast as this one, Anisa. Like in
Right.
terms of technique, clinical, business, tech, like it's crazy. So you have to continuously educate yourself, your patients, and shoot, I bet. I mean, you could tell me, but I'm sure the way that you are conducting the entire practice, from like consultation to patient follow up to even maybe even your technique of like when you inject, has got to be completely different, right?
Oh my gosh, so different. I mean, I always call myself a conference whore because I'm at every conference and I'm just like, there's I learned so much from all the speakers because it's a variety of people from all over the country presenting on their techniques. And you hear like little pearls or how they market or how they manage their business that you could really take home and be like, wow, that's so cool. That worked for them. Let's try to implement it and see if it works for us. So I personally love conferences, and I love the rooms. What are those rooms called with all
A cadaver.
the vendor room.
Oh, yeah, yeah. The exhibit hall.
I personally love the exhibit hall because there's so much emerging in terms of technologies and skincare treatments that I could never keep up on my own. And that's a chance to see it all at once,
Yep.
right?
Yep.
I also love doing private trainings and really just having that one on one time with someone who's considered an expert, not only within this country, but outside of this country. I went to Manchester, New England to learn techniques from Raj Akila, and I thought that was so cool. And my next venture is to do Middle East, South America, or Asia and learn just what are they doing over there, right?
Yeah.
I need to know, like, how are they finding these incredible or doing these incredible results? Well, we feel so limited in the US because why? What's holding our hands tight? Is it, so I think it's so important. And then staying on top of studies, I think for so unfortunately, we are in a society where we really count on social media platforms to educate us. And while that's really entertaining, easy way, because you're already scrolling to
Yeah.
learn about something, it's not the best way, right? Because it's not evidence based. And I really love that aesthetics is going towards evidence based medicine, where we're really going back to clinical studies to show that this is what produces the best results, and
Yes.
it debunks all these misconceptions.
I think it's so important, and I see that happening, which is just like it's incredible. I mean, I know in some places you can literally go for a weekend and become an injector, and
Right.
8 hours of training. It's like whoa, 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 whoa. Like let's take a step back. Let's like really look at what is working from a clinical standpoint based upon facts and evidence. So I completely agree. And to your point about conferences, like I go to a ton of conferences. Maybe I'm a conference whore as well, but
Yes, I see you at every one of them. Like, what up, buddy?
yeah, yeah, for sure. I mean, like it's look, they're hard to go to because you have to leave your practice and your
Yeah,
team, and you have to have a team that maybe just keeps things going. And everybody's in a different state of their business. But
right.
I always get great takeaways.
Yeah, yeah,
Like we come from a business standpoint and a tech standpoint, marketing standpoint, but I started going into a lot of the clinical sessions.
right.
And
Good.
I mean, I have to know, like, okay, like before you guys would throw out these anatomy terms that I'm like, I don't even know what she's saying. It's probably like when we talk about certain terms with SEO, you're like, I don't even know what they're talking
Oh,
about.
I know. Over my
So it's like, hey, I need to educate myself on the clinical side. And then the networking is just extraordinary, right?
right.
And you can learn about all these other academies and trainings and Patreon pages. And so, like, it's what I love about it, Anisa, is everybody comes into this one area and brings some different level of expertise
Right.
to the table, and you
Hmm.
can talk about it, you hang out, and like every time I leave, I feel energized. I'm like, wow, this is amazing. It's exciting, great people. Let's go.
Yeah, I 100% agree. And I've been to all of them. Right now, my top two are the MedSpa show by AmSpa
Mhm.
and LAMCA. I think that the AmSpa MedSpa show is great for business owners because we learn so much about business. And LAMCA is really meant for just like, learning the best practices and aesthetic medicine um, by other great providers. So but I agree with you, Cameron. I think it's important to educate us as well as injectors about marketing terms like SEO. You mentioned I just learned like a few months ago what bounce rate was, right? The amount of time someone is on your website until they bounce to the right. Am I saying this
Yeah,
correctly?
yeah,
But
yeah.
it's important for you to know that so that way you're really making sure that whoever you have for your website, and I'm so happy with Growth 99 managing my website because I love showing it off. I'm like, I tell patients to just go to the website to book instead of just giving them the booking link via Boulevard because I
Mhm.
really want them to see how beautiful
Yep,
you guys put together a website and how it flows and
yep,
how visually appealing it is and how enriching it is with content and the monthly blogs. I think it's so important to have someone really actively managing your website, not just when you reach out and say like, hey, just checking in, what's going on with this.
yep.
They're working the whole time on your website. So equally important for us to be educated on marketing.
Yeah, no, and I really appreciate that. And you guys have done a great job. I mean, it's you have like the way that you set up your call to action on the site where you have the booking that goes directly into Boulevard. It's easy to use, even on your Instagram with your Linktree page. Everything has a great CTA. And so whether you know it or not, you have a great knack for saying, "Hey, like you obviously you create great content, but then that call to action is there, and it leads people right down the funnel to, hey, book an appointment. It's seamless, it's easy, it works." I mean, I still talk to practice owners today that they're afraid to leverage online booking because it may interfere with their day to day operations.
Yeah.
And I
Yeah.
have a hard time with that.
I know it's that resistance to not evolve because they're so comfortable with what has always been. But unfortunately, we have to keep up with the times, and the times are online bookings and texting, and not so much the phone calls and the mailers. It's We have to progress as a business, otherwise we're considered outdated. And aesthetics is so quickly evolving that you have to stay on top. If you're not I always call this it's called a Harvard it's a Harvard theory, but basically the theory is that there is a duck that you see floating across. Have you heard about this theory?
No, I want to hear it. When you
Floating across the pond, and they look so calm and they look so at ease, and you're just like, wow, that is so pretty to see a duck just floating by. But really underwater, they're like paddling, like going super,
oh
super
yeah,
fast
yeah,
trying to keep up, right?
right.
That analogy hits such home as a business owner in aesthetics, because you're trying to stay afloat where everyone's like, wow, she really has it figured out. Everything's so perfect about her business with the Medspa, the website, and everything's so dialed in. But it is a constant hustle, right? Of just staying on top and just being a part of the now. That,
Mhm.
it's not impossible. It just takes hard work.
It totally does. No, that's a great analogy. When you said that, I immediately felt that. I'm like, oh my gosh, yeah. I think like social media in a way, marketing in a way in general. We put stuff out there that's put out in a way that is, there's some editing that takes place, right? There's some thought process behind it, and it's to show like, hey, this is a market. Like you have to make it look good, right?
Yeah, of
But
course.
behind the scenes, like, my gosh, I mean, I'm sure there's tears being an entrepreneur, right? Like
Definitely.
there's some dark days, bad things happen. You almost have to hold the whole thing together and make sure it looks like great, while there's always like some sort of friction or a challenge or something that's taking place.
Definitely, definitely. I agree. And I think the hardest challenge, and I think a lot of business owners can agree with me, and those that are thinking about opening up a business, just know, managing employees can be the biggest challenge. And it's really just making sure that they're happy, making sure that we are all working cohesively when you have so many different personalities. I went from 5 employees last year to 10 this year because I increased my footprint. And there's a lot of new personalities that comes with growth, and just making sure that we're all dialed in, we're all in it for the right goals, and hiring like-minded individuals is really what's going to help you create such a strong team that's going to propel your business, because it's really not just me. I mean, I might be the face of brand, but I have a whole team behind me, managing a lot of aspects of the team or the business. So some things that we do that I think are very valuable is we do monthly check-ins with our employees to make sure that they are feeling good, how anything that's come up that we need to address, and really doing quarterly team bondings. I think that's really helped us be more
Yeah.
synergistic with each other's energies.
Yeah.
Allergan provides this color energies team bonding exercise. I'm not sure if you've heard of it,
Yeah. Oh yeah.
but I think that's helped us identify who is what color and then how to work with them better. So, team and managing people is important, but I want to talk about hiring for a second, because I
Yeah.
think that's something I finally figured out now.
Yeah.
I'm a type of girl that I really do like everyone immediately. And I'm not just saying that like, I'm so like, likable and I like everybody. It's just I don't have any reason to mistrust anyone unless you give me one, right? So I think when it came to hiring, I just was like, oh my God, she's so cute. She's so bubbly. You're hired. We get along. But it's not really looking at longer term in terms of fitting into the business or the culture. So something that I've adopted in my hiring process that I do want to share with other owners or people opening up their business is a 3-step type of process of, not only are we posting the job application online, but we're really taking that first interview to FaceTime. Do they show up on time? Do they present themselves well? Are they really keeping eye contact? Are they engaging, right? And then you can take it to the next level, inviting them in, doing like a shadow day for a few hours, right?
Yep.
Having them work with the team. What did the team think? What did they think? Just really making sure that they align. And then lastly, I would do another, sit down interview, asking the hard questions of more like behavioral, right? Situational ones. And after they hit that 3 points, I think that creates such a great team that will fit your culture. And of course, the rest of your team that is it's just fluid.
Yep. Yep.
Right.
No, well done. I think like it's really hard to find the right team that aligns with culture, understands the KPIs, where you're going, has the ability to like show up on time. I think that's great. It's like, hey, let's have a phone call. Let's do FaceTime first, and let's see how prompt you are, how well spoken you are, how the fit is. Bring them in. Let's see their work.
Right.
Right. It's almost like a tryout type of session, right? And then the final one, like you said, like let's have this one-on-one sit down and let's get into the meat of it.
Right.
And then from there, make your decision. So that's a lot. Shoot, going from 5 to 10 in a 12-month period.
Yes. I doubled my injectors, which is adding, 1.5 because one's part-time to the team. I have another person on marketing. So now I have someone just managing marketing on its own with the SEO, keeping the brand looking really cohesive and website and just overseeing all the platforms. And I have someone for social media manager. She's also full-time. So 2 full-time just for marketing and social media.
Nice.
I have, 2 patient care coordinators. I have 2 medical assistants. I promoted one of my medical assistants to practice manager this past year. So now my husband's involved. So really it does require a village to run a successful business. And that's why I always say this, that I have no intention of expanding and having multi-locations. Seeing that my team is so dialed in, someone could be like, well, now you can replicate it, right? You clearly have the recipe for your business. Just have that blueprint and just go to other cities. Why wouldn't you?
Right.
And my thought is that if it's this hard to manage one business, right, I can't imagine what it'd be like with multiple. And then you have to think, okay, what's the reason behind multiple? Well, now you're just thinking about profits, right? And increasing that. And I understand that could be someone's business model and that's their primary focus is to increase profits. But mine has always been to do the best of aesthetics, to be known as the top injectors, to really have everyone dialed in of upcoming procedures, but really being evidence-based. And that's how I train my injectors. That's how I expect them to, really define the standard in aesthetics. So keeping it boutique, keeping it high quality, and keeping it really a fun, balanced environment.
I love that. And I mean, that's going to create, profits just on its own. Right. And I think that to your point, if profits start to become the first topic of conversation where you are now, like obviously, look, at the end of the day, it's a business. We have to turn a profit and you got 10 families you got to take care of. Right. I mean, at the end of the day, like that's what you're doing, which is incredible. Like when you think of it that way. And then all these patients you're taking care of and you're building confidence in them and they're feeling great. Like it's a tall order. So I agree. If you focus on your craft, understand exactly what you want to do, like those profits are going to come and you're a true walking, talking individual that is doing that.
Right.
It's amazing.
Success will come. If the belief in heart is there, people will just see it, smell it, feel it, taste it. It's just there.
Yep. What's your husband doing in the business?
So he actually does real estate full time, but he doesn't have an office for real estate. As you know, you have flexible hours of working from home and being out in the field. So I just have him in the office working with real estate, but now he's been so much more involved in the operations, which is very much needed in terms of setting up Boulevard, making sure our patients are being booked properly and just being tapped into everything that's growing, just making sure it's translating on social platforms and on booking platforms. And then he's really helping managing the staff because at the end of the day, I'm in the room 80-90% of the time and I'm not really seeing what's going on outside, right? And it's
Right.
nothing bad. It's just making sure that we have good flow, good synergy, and everyone is feeling that they are part of this, great workflow, but keeping the culture intact.
Yeah, I love it. I see that happening more and more when I'm just having conversations with people I know, like the husband and wife duo. It creates something really compelling because there's just levels of expertise both bring to the table, you know,
Yes.
and it's just super helpful and probably a lot of fun. I mean, who knows? I'm sure there's times where it's not, but I'm sure for the most part it's great. Um,
It's I funny. I was scared about it in the beginning because I'm like, oh my
yeah,
gosh, I don't know about like having my dessert. I don't know the common saying, but I just don't want to have my dessert all the time. Is that
right.
you know what I mean? And just having him
Yeah,
around, I want to
totally.
save being looking forward to going home and seeing him and doing our dinners together and whatnot. But it's been so helpful. I actually talk to him all the time. Like, what took you so long? You joined my practice year 5. Like, why were you just waiting? He's like, well, it was your thing. It was your business. I just didn't
Yeah.
feel like I wanted to be a part of that. It's just your thing, and I want it separate. But it's so good.
He's super cool. I've had the opportunity, obviously, to hang out and get to know him at the conferences,
Uh,
and I've enjoyed that. So that's awesome.
and women love
So,
him at beauty booths.
oh
When he
yeah,
walks in, like checking people in, they're like, "Oh my God, you're Anissa's husband." Just brings that male energy into the
totally.
office with patients and staff. It's good. It's a good
Yeah,
buffer.
that's fun. I love it. Hey, so as you've went from 5 to 10, some are providers that you brought in, right? New providers, you said.
Yes. Yeah.
Okay.
Exactly.
What was there? Did they come with existing patients? Like how? Because I know that's always been a challenge, right? When you grow a provider count,
Mhm.
then obviously that comes like, okay, what's the capacity? Like, because we want to make sure that you're booked. We got to get you booked, right? What has
Right.
your strategy been around that?
Oh, this is so hard, and I feel like it's painful to even talk about because I've been through it. I First of all, I've tried hiring injectors without any experience, and I tried it twice. And both times I felt that my business is at a point where my patients deserve to have an experienced injector only because in the beginning there's so much trial and error, right? I know that I kind of messed up quite a few times to get to this level, and you
Sure.
guys will too, and that's okay. But
Yep.
I think when our patients are paying top dollar in Newport Beach, they do deserve at least an intermediate skill set, at least, right? So I didn't feel that that worked with my business model. Um, Not to say that it will never, right? So I do hire someone who is experienced. And my thought behind having someone experienced is that I also wanted them to have a higher degree of education. And I thought only hiring nurse practitioners and PA was going to be my cutoff. I did not want to entertain nurses. I just felt that, when you have that extra level of education, there's no chance of maybe going back to school and getting it. I can have you secured in your position and we'll call it a day. But I found that the most talented injectors are RNs, so
Yep.
they crave being masters at their craft, and they really enjoy where they're at in their career, and they don't feel the need to go back, and that's okay. You
Yeah.
don't really need it in aesthetics other than clearing a good faith exam. Let's be
Yep.
honest, right? And I'm a nurse practitioner. I have another nurse practitioner. It's okay to have that RN in the business. So I hired an RN with that experience. She came from Texas, did not have a following because of out of state. And she was brought on this past summer. I hired a nurse practitioner who came from Georgia, and she was brought on earlier this year in January. And then I have a nurse who just graduated to be a nurse practitioner, who came back from maternity leave this September. So she's back in the practice, but part time. So being part time myself, part time with my maternity leave returner, and P, hence is one full time. I have two other full times. So if you really think about it, it's three full time providers, and we're going to probably add one more to our team by next summer, and then we'll be maxed out. And I'm perfectly fine with that.
And you're good with that. I love
Yeah.
it. You know your journey. You know the destination. You know where you want to go. That's amazing. You have great vision. I don't know if you've taken the time to like roadmap this out or how you've done it, but I really like the vision and what you've gone through in terms of like because I'm sure there's been times where you've hired people that hey, I'm not going to do that again, right? And now you have a process in place. So That's really interesting. And it takes time to get the people to the team. I mean, that's a big move from Georgia all the way to Newport. I mean,
Yeah.
I bet
And
that was from social media. Am I wrong?
yeah, no, you're correct. She followed me for a couple years on social media, and she applied because she knew she wanted to come back to California where she's from, and she's actually from NorCal. So for her to come to SoCal and join our team, it was really, really, truly an honor to see someone make that move across
Jeez.
country. And
Wow.
then the other RN from Texas also found us through social media, and then she also said that she found our job posting, I think, as well on online. So it's
Jeez.
cool because they could see the business, right? The brand.
Totally. I mean, it goes way outside of just patient acquisition. This is
Right.
like this is talent acquisition that's willing to move across the country
Right.
because of the power of social. That's what I want the audience to know is like, look, like you guys, like there's a big world out there outside of your local market, and people are you're an interesting. Everybody's interesting,
Yeah.
right?
Yeah.
And it's a way of just like expressing it through these channels that's going to help you guys. Like if I hear it all the time, and he said all the time, like I'm not really big on social. I own a med spa, I own a practice, but I'm just not really big on social. And not that we're necessarily a social media, consulting company. We're still like that. That is one of the most important arms that you have to control as a practice owner,
Right. Right.
right? The talent that you got is incredible there. So I know you have this boost camp. Can you
Yes.
talk to us a little bit about the boost camp?
Yes. Well, it was actually really inspired from so many DMs that came into my inbox on TikTok and Instagram, finding me through videos where they felt inspired to become an aesthetic provider that they really wanted to learn from me. And I think a lot of experienced providers are seeing a lot of messages like that come through in their inbox, but not knowing where to navigate, right? Because they don't have a fit formal training program. They don't know where to even start because having one business is enough. And I definitely resonate with that. So I decided to actually start with Patreon. It's an online training platform I'm sure you know of, but for our listeners out there, it's really cool because you can pay like 50 or $100 a month and you learn the best techniques from the best providers in the business. And it's not just techniques. I share business strategies of, this is what I changed in my business this year, based on the economy, or I talk about marketing strategies. I talk about what I keep in my office for emergencies. I talk about my protocol, just so many things that I share online that
Yeah.
is so valuable for like literally not much. And you could watch these videos at any point. Seeing that grew so much, Cameron, I was shocked to see how much that grew. That
Mhm.
I realized on Patreon, people are like, okay, this is great, but I really want you to do hands on because I want you to see my movement to the skin. I want you to guide me.
Right.
I want to hear more of the why of when we're injecting. So
Okay.
then that gave birth to Boost Camp,
Wow.
similar to boot camp, as you guys know, and that's where
Wow.
we are really focusing on filler injections, of course neurotoxin as well, but every boost here at Beauty Boost is filler. So Boost Camp is just like kind of like filler camp and just injectables, but we will also focus on other areas. So it's 6 hours. You come in, you do hands on, and I really finesse your technique, and it's 1-to-1. Um, it's really cool to see everyone just kind of travel from everywhere and see where they are at their level of training and just really taking it to the next level that they never thought they could be without that guidance because they're always so scared to do the next best thing because you're in that comfort zone, right?
Yeah. Oh yeah. I mean,
So
intimate hands-on training. That's amazing. How often do you do it? You said.
I do once a month. That's my cadence just because my time is so limited.
Yeah,
Of
that's a lot.
Yeah, yeah,
Yeah.
but it's rewarding. I love it. And I'm also an allergen trainer, so
Mhm.
going all over the country myself to those practices is really cool. It's nice to see injectors from all levels just working as a team to further themselves. It's not so competitive; it's more teamwork. It's really cool to see that synergy.
Yeah. What's interesting is there's this notion out there, this process out there. Once you have a business, whether it's a practice owner, you own a med spa or whatever, and you start working on it for a year, 2 years, 3 years, 4 years, things come, and I call it attaching yourself to the existing.
Yeah.
Right? You have the practice, and then you're like, okay, I'm going to launch this Patreon page. That would have never have happened if you didn't have the practice, right?
Mm, yeah.
So then there's a Patreon. It's a business inside of a business.
Right, right, right.
It's like, okay, how do I give this value? I mean, shoot, for someone to pay 50 to $100 a month to get access to something like that, it's like,
All of it.
that's,
And my
I mean,
marketing manager always tells me, she's like, you give out too much info. Like people should be, and I'm like, yeah, but it's everything that I'm learning, and it's so quickly evolving that if I don't share it now, it's going to be old news later. So I have to say it,
yeah,
But she's like, it's just a little too
good
much with
point.
your numbers, and I'm like, whatever, I just take it or leave it. I have to share where I'm at with my business, and there's enough business to go around, as
I
the
love
common
that.
thing is.
Well, I mean, you're giving back too. Like, that's really cool.
You
And
know,
then from that comes the boost camp. You're like, okay, because now you have the Patreon people are like, okay, this is great. I want more. You're like, okay, boost camp taking place. Right. And so for the audience, that's what I want you guys to know. Like, the longer you're in business, ideas are going to come to you
right,
that are wrap around with your current business model.
right,
It's happened to me. It's like there's a pattern there with entrepreneurs. It's because you're always thinking about entrepreneurship and how to give value, how to help, and it's our duty and obligation to get out there and do it, right? And so,
right.
like, that's amazing.
It will grow itself, I promise. And, just Patreon becoming a thing because of I'm answering a demand, and it taking off. And then becoming an allergen trainer, just like I got nominated randomly. I mean, of course, I love allergen injectables, but nominated, then I became one. And then it's like, I love it so much. And that's cool that that presented to me. And then you asked me to become, come on this podcast. These things just kind of happen
Yep.
as your business continues to grow, because people will start to see that, and it will take care of itself. You really have to have that belief.
Yeah, I love it. Now let's talk about. I know you're super busy, and thank you so much for taking the time.
Thank you. You
But
too.
safety's huge in this industry, right?
Yes.
It's like, what is your approach to safety? Can you walk us through that?
Such a great question. I'm so happy you asked about this. So I think, I was privileged to work in plastic surgery, where I got to assist with facelifts and really see facial anatomy firsthand, and not just memorize off a textbook, even though that would have been, of course, the easier route. It was really cool to have that as my first hand knowledge of facial anatomy. So I'm so passionate about it because of my background. Now, when it comes to new injectors injecting, because they cannot wait to get their hands going, and I totally get it. It's like you have that itch, that crave. You just want to do it, and you want to be great, and you just want to enhance people's beauty and make them feel great.
Totally.
I believe me, I know that all too well. It's so important to commit time out of your schedule to really understand facial anatomy and really see how whatever you're injecting into your patient's face, how it behaves. So I think equally as important as facial anatomy is your 2 week follow-ups, right? Because you'll start to see when you inject in the wrong plane of tissue, filler, or the wrong muscle with neurotoxin, how it results. And you go back to the why. Why did this happen? Like, oh, I hit the levator palpebrae. Because why? The supraorbital foramen has this little drip, tunnel that can go through the eyebrow. Or like, oh, they're not smiling well after mid-cheek filler. Why? Oh, there's a new study about the transverse facial septum that it could fall through, and that makes people how they learn to smile, right? So being on top of the basics of facial anatomy and evidence-based research will make you an all-star injector. I promise you, will separate you from every other player in this business.
It's huge. I love it. Thank you so much for sharing that. That's
Yeah.
big. I mean, look, I know that there's been a lot of situations, obviously, with the industry on the rise and how much demand is out there, and so approach to safety is huge, and that creates a lot of patient loyalty as well, right? Because at the end of the day, yeah, they want to come and like feel confident and all the great things that the industry provides and that the provider provides, but at the same time, like, my gosh, I can only like, wow, that would be scary if something were to happen and we weren't investing in safety, right? Like, that's a
Right.
big deal. Okay, so really quick, I know that you're very process oriented, very organized. What does your checkout process look like, right? When someone's done, like, is there a process? I'm sure, like, you guys have an SOP, like rebook them, maybe talk about memberships, talk about your events. Like, what does that look like?
It's so cool that you asked. I'm like, I'm one waiting for someone to ask me this, because we're like already on version 5 of our SOP. But we have a very, I call it like a song and dance patient flow, right? Where everyone knows their part. As soon as a patient walks in, to who's rooming them, to who's doing the photos, to who's doing numbing, who's putting together their before and afters, who's doing the treatment plan, to who's walking them to the checkout desk, to how they're checking out, getting booked for the next one, to how do they get on the tracker is what we like to call it. If they don't book, they go onto a tracker, which is like our CRM.
Okay.
We're looking at more finesse ones, but it's like a really huge Excel sheet. We just haven't found one that works for our practice just yet. To kind of making that whole journey a complete circle. I really believe that the patient's door should only be entered so many times, because then it's just chaos. If they feel like MA is coming in, then the provider, then the PCC, it's just, you really want it to be so fluid. And I remember I had a patient that said that, wow, your practice is like a well-oiled machine. And I'm like, because it didn't come overnight. It took hard work to see how that flow would really play out in my business. So if you guys are interested, I have it on, I'm going to be posting on my Patreon. I'm just working out some final kinks, but I think it's really helping our staff just really know where they belong at any given moment.
Yeah, no, it's huge. It's huge. I mean, obviously rebook them. So if they don't rebook, they go on the tracker.
Oh my God, of course. No one, and we always say for their 3-month Botox, it's just book now. It's just like at the dentist, you're just doing it in advance. If you can't make it in 3 months, totally fine. We get it. But we do give people priority if you're rescheduling. We don't give people priority if you're calling in just to make your appointment, because we realize people who are rescheduling need to be in. Yeah. Right. And if they don't schedule, they're like, no, I'll take my chances and I'll just call in. They still get on our calendar to contact in 3 months. Okay. So my patient care coordinator has a calendar, and every patient that week that 3 months ago didn't book, it's that week she calls and reaches out. And we have 3 attempts. We have first the text, then 2 weeks later, 2 days later, a phone call, then 2 weeks later, an email. So that's our processes, and it's really helped. It's worked for us.
That's amazing. I love it. You guys, take note. She's got the tracker. If they don't rebook, they have a sequence to reach out. If they don't rebook, they know exactly when they came in. And I bet that you have specific language on that. Hey, if you book now, you get priority, right? Oh, yeah. Like that, just hearing the word priority, it's like you're on the VIP list. So you might as well just do it now, right? So, and look, yeah, sure, they can cancel, they can reschedule, but at the same time, I know that increases retention rates, right?
Yes. Yeah. It's been quite an interesting year to evaluate retention, because we came off of such a weird year in 2022 and 2023, when so much was moving in our market in terms of employees moving, right? And then patients kind of moving around, because some people can't afford to live in Newport Beach anymore, so they'll go out of state, or just a lot of movement. So 2024 was an interesting year to evaluate that retention. But we are really dialing in, because we find that our best, of course, customers is ones that you are really putting value back into. It's not so much, oh, where's a new patient. Just focus on what you have, because they're already loyal. They're already here. They already trust the brand. Just keep it going.
Totally. I love it. And I know, you said one word that really resonated with me in terms of really helping with retention is treatment plan.
Yes.
Right. If you have a treatment plan, it's massive what it does for retention. Mm-hmm. But now you're on a journey together. It's not just come in, quick fix, buy, book when you book.
Right.
That's not the right model. The model is the treatment plan. It's the journey. You're aging. You're going to age tomorrow. So I can't stop that. Right. But this is a journey together. I love that.
It took me so long to get to the treatment plan part. I was that girl that's you tell me what you want, instead of no, you tell me. And then I started to get confident slowly, because the hardest part about being a new injector is that as much as you want to recommend a full face plan, you might not feel confident in your technique to do that, right? So you kind of want to withhold information so they don't get excited and want to book for that, because you don't even know how to do it. And I get it. It's a double-edged sword. I still think that it's due diligence for us injectors and providers to give that treatment plan, because even if you don't know it now and you learn that technique later, months later, a year later, you can always go back to that patient and say hey, it was on your treatment plan to do your, your smile lines, which you didn't feel comfortable at the time. Let's do it now. Yeah. And then they'll be oh, she waited to not push me to do it. And it's just, it's this whole psychology, right?
Yeah.
But I didn't get there until year 3. So to get that full face, plan, and then the timeline, believe it or not, it's just, I'm adopting that now, year 6 into my practice, because I found that most of our patients will get to that full correction within 2 or 3 visits. And then what? Bye for a year? No, we do want to see them back periodically for microneedling, Botox, you name it.
Yep. All the maintenance. So was that something that you like took the time to hire a coach on? Was that something that just came naturally? How did that evolve?
It's something that I really had to think through. I think obviously the way that it could have been easier is getting a consultant and telling you like this is what works for all these other practices, just try to finagle it in yours. But I didn't.
Yeah.
I always choose to do the harder way out because I'm like, if I didn't figure it out, it doesn't come off authentic. It's just, I don't know. It's kind of self sabotage in a way. So I came up with a plan where I put everything that they need, from upper face full Botox to like lower face fillers and skincare treatments. And then I say at their consult, I say, I know this is a lot, but let's prioritize it now. Botox, skincare always be my number ones. Filler, we could wait in 2 weeks when you come back for your follow up. And then anything else that we find is not like needed, like a nose boost, right? Like we could do that anytime. We'll bucket that for another. But I do tell my patients, everyone does achieve optimal correction after 2 or 3 visits. I know you can't do it today, but this is your pricing. This is a plan. They will figure it out. They'll get care credit. They'll do patient fi, now Cherry. They'll ask their man. They'll pull from their savings. They will make it happen if you win them over in that plan.
100%. No, well said. I agree. And I see it happening in other practices. The treatment plan's huge, the consultation's huge, the SOP for the strategic checkout process is huge, and then obviously social. So, look, I know you're busy. You've shared a lot. This is super incredible information. So for the audience, you guys, like, take note. Anisa knows what she's doing. She's been here a long time. I mean, everything she's doing on social media, everything that she's doing in her business. I mean, she's hired 5 people in the last 12 months. She has it down and she knows where she goes. So like, if someone wants to reach out, connect with you, maybe they want to join your Patreon page, maybe they want to come to Boost Camp, or who knows? Like, what is the best place for them to find you?
So follow us on social media. I personally answer a lot of the DMs, especially on Instagram. So you can start there. If you're interested in hands-on training, email info@beautyboostmedspa.com and we'll send you all the info that comes with our hands-on. I also offer shadow days because I understand, people might be at a point where they're comfortable hands-on. They just want to see how the business is run. And I get that. I'm nosy too. So come shadow me. I'll show you everything. But it's really about making that first step, and that's connecting with me. And I'm an open book, a little too open is what some people say, but happy to help.
I love it. You guys go follow her on Instagram. It's a great place to find her as well. It's Beauty Boost Med Spa. She's out of Newport Beach. Incredible brand, incredible team, incredible person. And so thank you so much for taking the time. I'll leave it at that. I really appreciate it. So for the audience, you guys, if you found this content valuable, please share it. That's my biggest ask. Share the content. There's someone out there that can get value from this conversation. And that's the whole point. We're taking the time out of our day to do this stuff. We want to make sure that it's shared so that, anybody that has the opportunity to tune in can really get some value. So that's what it is, guys. I appreciate it. Thank you so much for joining. And until next time,
Thank
happy
you,
injecting.
Cameron. Thank you so much.
Thank you
Bye-bye.
so much.